This conference will now be recorded.
Well, wonderful. Well, thank you all for joining us today. We're really excited to have a session from many wonderful people at Robin Schwartz, Dennis Weidman, Emily Bofeld, and then Matthew Gardner, who's going to talk about returning to school and campus during the COVID-19 pandemic and interpreting the current state guidance, which is an ever-changing dynamic. So we are really excited to have your group ready to present on this topic, and I know you'll probably have just tremendous things to say to us, since many of us are somewhat confused about where we are. So Dennis, I'll turn it over to you.
Great, thank you, and thank you everyone for taking time out of your busy morning to join us today. A little bit of by means of an introduction, my name is Dennis Weidman. I'm an attorney at Robin Schwartz, of course. I work from our Collinsville office. I primarily practice in the area of labor and employment, but we do handle a variety of other areas of law for our clients, such as board governance and defending our clients in litigation in state and federal courts. With me today also is Emily Bothfeld. Emily kind of heads up our higher education practice group and works with student law. And then Matthew Gardner works out of our commercial and construction practice group, handling transactional type matters and construction type matters for our clients. Robin Schwartz, 2020 have brought us a lot of things. It also brought us this year our 50th anniversary. Our firm was founded about 50 years ago by three attorneys who used to be attorneys at the State Board of Education and decided that educational law could support itself as an independent area of practice, and literally started the first school law firm in the state of Illinois. We represent about 250 school districts, colleges, and other units of local government throughout the state, including park districts and municipalities and villages and county government. So since I practice mainly in the area of labor and employment, I'm going to go ahead and get started in kind of that area this morning. If you want to flip to the next slide, please. I'm going to start kind of with a board governance type issue. As you know, we have been under a series of executive orders from the beginning of the pandemic. Some of those executive orders addressed how public bodies could conduct meetings virtually. This culminated in an amendment to the Open Meetings Act, I believe, in May or June, which continues to essentially codify the ability of public bodies to meet virtually if certain conditions are met. First of all, we have to be under a current disaster proclamation or order. We are currently under two of those. On August 21st, 2020, Governor Pritzker issued Executive Order 2052, which reissued all of the previous executive orders relating to COVID-19, and that is good through September 19th. And then also on that same day, the governor issued the most recent COVID-related disaster proclamation extending the disaster through September 19th, 2020 as well, which means units of local government can continue to meet virtually if the head of the public body determines that it would be unsafe for the body to convene in person, and if a couple of other conditions are met. One would be a member of the public body, the head of the public body, the secretary, or legal counsel for the public body would need to be present, physically present in person for the meeting, unless the head of the public body would also determine that that would be unsafe as well. Also, the meeting should be recorded and be able to be broadcasted publicly, either through the website by recording it, where people can go back and watch it later, and broadcasting it live if that's feasible. Also, I would like to clarify that the Attorney General's public access counselor has suggested that some of the means by which public bodies were conducting public comment, initially it was allowed to strictly do public comment by written comments. An individual could email or send in their public comments, and those would be read at the meeting. The public access counselor has now indicated or suggested that public bodies should also provide a means for live public comment during a public meeting, whether that would be through the virtual platform or having a video camera and microphone at the location of where the meeting is being held, so that the individual could show up there and speak publicly with the public body. If we could move on to the next slide, please. There's also been, and we want to try and keep this not just a basic return to school, return to campus presentation. We've been doing many of those, and many of our college clients and school districts have been back for several weeks now. So we want to focus on some of the new changes that have occurred since schools and colleges have opened. For many of you, it may just be a point of curiosity. You may have no connections with schools or colleges. Some of you may work directly for schools or colleges, so this is certainly relevant. Others of you may be school board members or college board of trustees and would be interested in the current state of some of the guidance. One of those actually just issued recently from the Illinois Community College Board, and communicating some guidance issued from the Department of Public Health and the governor's office, and that is reporting the number of positive cases on campus. So this primarily applies just to higher education, community colleges, colleges and universities in the state. It does not apply necessarily to K-12 institutions, but it does encourage colleges to display the number of positive COVID-19 cases on their website. It's to include both the number of students and employees. The guidance suggests that this could either be a combined total or that you could separate them out separately, listing the number of positive employee cases to date and the number of positive student cases to date. It's supposed to be updated weekly, listing both the new weekly totals and the running cumulative totals for the period that school has been open. And it's really just for active cases on campus, meaning those employees and students who have been on campus. So if somebody is working remotely, a student is learning remotely and would be diagnosed with COVID, those numbers would not be reported. And of course, we're not identifying students or employees by name. It's strictly a numerical count. If we want to flip on over. Next, as time permits, I want to go through some of the employment-related issues, such as employees who may be resistant returning to campus, employee accommodation requests, employee leave of absence issues under the Family First Coronavirus Response Act, and then, as time permits, some compliance issues with COVID-19 protocols. So the first question really is an employee's general fear of COVID-19 a basis for returning to work? And obviously the answer is no. Simply a fear of contracting COVID-19 is not a reason to, a valid reason to stay home from work, but there's other considerations and other factors that employers should consider. If we want to flip over. While an employee may have some concerns about returning to work due to COVID, it may be related to an underlying medical condition. So we need to have a conversation with the employee to determine if that individual may be a qualified individual with a disability, to determine what, if any, accommodations, reasonable accommodations we might be required to offer that employee to be able to perform their essential job duties. Uh, 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 the main point in this is the individual must be a qualified individual with a disability, and it must be the employee's disability. We've been receiving a lot of requests from clients that an employee really would like to stay home from work because they have a spouse or a child that has medical conditions that may make contracting COVID-19 worse. So that is the reason they would like to stay home. It has to be the employee's disability for the Americans with Disabilities Act to apply, not the disability of a family member living in the household with the employee. But there are some other things that might apply in that case, which I'll touch upon in a moment. Also, the accommodation has to be reasonable. It has to allow an employee to be able to perform their essential job duties. So if working remotely would not allow the employee to perform his or her job duties, that may not constitute a reasonable accommodation. Many teachers can teach from home. It's hard for a maintenance employee or a cook or somebody like that to work from home. So you have to look at their job duties to determine if they can perform their essential job duties by working remotely. If not, we may have to look at other accommodations within the workplace to accommodate their disability. We've addressed issues of having employees isolate, providing them with separate areas to enter and exit the building, maybe parking closer to the building, providing them with breaks that might be separate from when students might be moving around or other employees, letting them maybe come to work a little early, leaving a little early so that they're not coming in contact with a lot of other people in the building. So there are other accommodations you can look at. I mentioned also you want to engage in the interactive process with the employee. Before you make a decision, make sure that you've obtained necessary paperwork, medical information from the employee to determine whether or not they might be a qualified individual with a disability, and then what accommodations their healthcare provider might be requesting. I did mention that there's some alternative forms of accommodating the employee to consider. While they may not be a qualified employee with a disability, or they may be wanting accommodations due to a family member, you might look at other alternatives such as family medical leave for the employee, even though they may not be disabled, or it's a family member that's disabled they're wanting to address. Allowing them to take certain family medical leave may help accommodate their situation. Next, I kind of want to move on to some of the leaves associated with COVID-19 during the pandemic time that we're in. The Family First Coronavirus Response Act was passed to provide employees with two types of leave: emergency paid sick leave and emergency family and medical leave expansion. And both of these are kind of treated separately. Emergency paid sick leave involves one of several factors. If the employee has been subject to a federal, state, or local quarantine isolation order related to COVID-19, or has been advised by a healthcare provider to quarantine due to concerns related to COVID-19, or is experiencing symptoms of COVID-19 and seeking a medical diagnosis, or is caring for an individual who is subject to a quarantine order or advisement by a healthcare provider as described within these guidance. So the emergency paid sick leave primarily relates to the employee's need to be home due to either having COVID, believing they have COVID and seeking treatment, or caring for a family member who may have COVID or is seeking treatment, or simply being required to stay home and isolate after being exposed to somebody with COVID. That could work as well. The other type of leave, though, is the emergency family and medical leave, expansion leave. And that is essentially for an employee that needs to care for a son or daughter. If the son or daughter's place of care has been closed, whether it's daycare or school, has been closed due to the pandemic, due to COVID-19, or any reason related thereto. So back in the spring when schools were closed, certainly employees would be entitled to that sort of leave if their child's daycare was closed or if their school was closed. But now that we're back into a school that we're remote learning, some schools are open. Some schools are even doing a hybrid type learning platform where students are in for a couple of days a week, home for a couple of days a week. So it's a combined in-person remote learning platform. If a school is doing remote learning or doing hybrid learning for purposes of applying the Emergency Family and Medical Leave Expansion Act, that would constitute a closure. So for the days that the student is learning remotely, the employee could use their family medical leave for that purpose. Now, the school actually has to be closed or engaged in hybrid learning or remote learning for that to occur. If the school is simply, and we have many clients who are doing this, that they are in-person learning, but they, by requirement of the state, is giving families the option to remote learn. If a family would elect to remote learn, and that would be an employee of the district, such as a teacher or a support staff person, if they are electing to remote learn when in-person learning is being offered, the Emergency Family Medical Leave Act would not apply in that case. So what does the leave look like? Typically for the emergency paid sick leave, when it was for the first examples that I gave, the employee is entitled for up to 2 weeks, 2 work weeks of leave, up to 80 hours, not to exceed 80 hours, and they are paid their full salary for that 2-week period of time. Unless it is to care for a immediate family member, and then the employee is only entitled to 2/3 of their pay, capped at $200 a day for that 2-week period of time. For the Emergency Family Leave Act, when it's to care for a son or daughter and their school or daycare has been closed due to COVID, that is for 12 work weeks. However, the first 2 weeks of that is unpaid. An employee can substitute their emergency sick leave if they want to, or regular paid leave that they might have through the employer to receive pay for that 2 weeks. But then the final 10 weeks of the 12-week period, the employee would be paid at 2/3 of their salary, not to exceed $200 per day. One of the issues that came up with that here recently was whether or not you could use your leave intermittently. And the Department of Labor had a regulation that said family first. The emergency family medical leave could not be used intermittently. A district court in New York determined that the regulations were invalid and struck that portion of the Department of Labor's rules down. The Department of Labor recently amended its rules to clarify that, yes, you cannot use that type of leave intermittently unless it's for hybrid learning or remote. So if the school is doing hybrid learning and the parent has to be home a couple of days to tend to the student due to the student being engaged in hybrid learning, that would be intermittent use of the FMLA leave that would be permitted in that one instance. If an employee requires leave beyond the 2 weeks for emergency paid sick leave, or possibly beyond the 12 weeks for the emergency family medical leave, the employee could use other benefit time that he or she may have available. Many employers provide a sick leave bank, so maybe the employee could be entitled to use sick leave through a sick leave bank operated by the employer. If the employee has COVID and has medical complications due to COVID, they may be entitled to workers' compensation benefits if they can demonstrate that it was the contraction was connected to work. So there's a variety of other leaves that may apply in addition to just the Family First Coronavirus Response Act leave. I mentioned a recent amendment to the FFCRA regulations addressing the intermittent leave. The Department of Labor also enacted clarified several other of its regulations here recently that become effective actually today that might be worth mentioning. One of the regulations is before an employee would be entitled to FFCRA leave, work has to be available for them. That was one of the rules that this federal court in New York struck down. The Department of Labor reemphasized that rule, meaning that if you have a seasonal employee, somebody that's been laid off or furloughed, they would not be entitled to leave during the period of their layoff or furlough or non-seasonal employment. Also, intermittent leave, besides what I had mentioned applying to hybrid learning, the portion that was struck down by the court was the portion that the employer must agree to intermittent leave. Typically, intermittent leave under the Family Medical Leave Act, the employee can take without the employer's permission. However, when it's connected to the Family First Coronavirus Response Act, the employer must agree to allow the employee to use intermittent leave unless it's connected with hybrid learning. And the Department of Labor reinstituted that regulation as well following the court case in New York. And then there was a requirement under the former regulations that the employee would have to provide documentation of the need for leave at the onset before it would begin, before FFCRA leave would begin. And Department of Labor clarified that that information need only be provided as soon as practicable. It does not have to be provided at the onset of the leave if the employee cannot provide it at the onset of the leave. So I think with that said, I've got some return to work scenarios that I would like to cover that I'll let maybe at this point Emily discuss a little bit some of her topics, and then Matt jump in. If we have time at the end, I may come back to some of the return to work scenarios if you're interested in that. But I don't want to take up all of their time with my material. There is one thing I do want to say, though. I know Matt and Emily are going to touch upon this with respect to their topics, but one topic that's kind of come up here in the K-12 area are waivers or releases of liability. Because of the fear of contracting COVID and institutions being sued, we've seen a lot of our clients present us with a waiver or release of claims that they may have obtained from their insurer that a parent and student would sign, relieving the school district from any liability and waiving any claims they may have against the school district. Mainly in the area of athletics, we see that a lot. In order to participate in athletics, you have to sign these forms. I've seen it come up with respect to driver's education. I've even seen schools offer this to some of their coaches. Briefly, in Illinois, under the common law, in order for essentially these waivers, a parent does not have the legal authority to waive any claim that their child may have. So a parent can only waive the claim that he or she may have, maybe being a claim for medical damages, pain and suffering, emotional distress type damages. A parent cannot waive the claim of their minor child. Similarly, a minor child under the age of 18 does not have the legal capacity to waive their claim until they become 18 years of age. Any waiver would have to be approved by a court. So typically a student doesn't have the right to waive any claims against the school district. So that would be ineffective as well. When these are presented for purposes of maybe participating in driver's education, we don't think that public policy, because a school district has an obligation to keep its students safe in the learning environment, and we have a thing called free appropriate public education. We don't believe, as a matter of public policy, a student would have to waive their right to a safe learning environment in order to receive free appropriate public education. So we think those forms waivers would be invalid in that context. And then finally, a coach, an employee of the district under the Workers' Compensation Act would be covered typically for a work-connected injury, including receiving a contagious disease. The Workers' Compensation Act does not allow employees to waive any claim that they may have against their employer, and any waiver would then be invalid. So just something I wanted to touch upon. I've, as a parent myself in the Metro East, have had to sign those forms on behalf of my own children so they can participate in high school athletics. And we kind of chuckle when we sign them, knowing that there's not a whole lot of merit to them. So like I said, if we have some time at the end, I'll come back to some of the other material that I would like to cover, but I'll turn it over to Emily at this point.
Thanks, Dennis. Good morning, everyone. Thanks so much for having us. It's great to be here with you this morning. I'm going to spend a few minutes talking about some of the student-related issues that we have seen come up related to returning to school, whether that's in person or, as Dennis mentioned, through remote means or through some kind of hybrid model. So I'm going to kind of focus on three main areas. I'm going to talk about instruction and some of the instructional delivery methods that school districts and higher ed institutions are utilizing right now during this academic year. I'm going to talk about some health and safety measures that school districts and colleges are taking to mitigate the risk of exposure and of an outbreak within their school or institutional population. And we'll talk about the use of face masks as well, and requiring students to wear face masks. And then I'm going to talk about some requirements related to school and colleges' response when they actually have a positive or a suspected COVID-19 case, particularly of a student. So starting with instruction, for K through 12 school districts, they have local discretion to utilize in-person instruction, remote learning, or a hybrid, a blended model of the two strategies. No two school districts that I've seen or that we work with are going about this in exactly the same manner. We have seen many different, varied, creative solutions that school districts are implementing in terms of how they're going to be delivering instruction to students this school year. and they're considering they've considered a number of factors and are continuing to consider a number of factors as they move through the school year, deciding, when they want to bring students back in for in-person learning. Do they want to have students in person at all? So, districts will consider factors like the age of the students, the size of the school, what's the typical class size, as well as the trend of cases in their community. Because of course, cases are trending upward in some parts of the state and trending downward in other parts of the state, and that is changing all the time. So just note that for districts that are utilizing either remote or blended remote learning, there are clock hour requirements. So for districts that use remote or blended remote learning, their learning plans must ensure a minimum of 5 clock hours per day of instruction for students who would normally be receiving a full day of instruction if they were in person. So that's a minimum of 5 clock hours a day of instruction and schoolwork combined. And then there's also this recommendation that the State Board of Ed has put out that these students receive 2.5 hours of synchronous, live, real-time instruction out of that 5 clock hours per day. So those requirements apply. And then there's also a requirement, and Dennis alluded to this earlier, unlike for employees, where if an employee just says, I don't want to come back to work because I'm fearful of COVID, no medical issue, but they just, don't want to come back to work. For employees, the district, the employer isn't obligated to honor that request not to come back to work. But for students, where a district is offering in-person instruction, the district is required to provide a remote instructional option for a student upon a parent request. And that request does not necessarily have to be based on some type of medical or disability related need of the student. It could be just that the parent would prefer for the student to engage in remote learning. And then certainly for those districts that are offering in-person learning, either partial or fully, they should be continuing to plan for scenarios where they might have to either partially or fully go to remote learning in the event of COVID-19 cases or outbreaks during the school year. Because we're trying to focus this presentation on current issues, I just wanted to highlight one issue that we've seen come up as the school year has started with some of our school district clients, which are for school districts that are operating entirely in a remote fashion. We've seen some parents that are particularly concerned about screen time for their particularly younger kids, but also it could be middle schoolers or high schoolers. They don't want their child sitting in front of a screen for 2.5 hours, in a row, or 2.5 hours in a given day. And so parents have started to come forward and make requests for their child to opt out of certain remote activities. It might be, middle school offers, study skills classes or some classes that aren't necessarily a core, like a non-core class, like a math class. And we've seen parents start to request that their student be excused or not have to participate in some of those non-core classes. And what I've seen some districts do in this scenario, where they want to be able to accommodate the parent requests, but still make sure that they're complying with these clock hour requirements that ISBE's put out, is to actually treat those students like partial homeschooled students. So they would kind of document and categorize those students as being partially homeschooled. So that way they're still participating in those core academic classes virtually and in a remote fashion, but then they wouldn't necessarily have to be satisfying that 5 clock hour requirement, that 2.5 hours of synchronous learning, because they're technically being homeschooled for whatever portion of the day. So then moving into higher ed, Similar in that higher ed institutions have local discretion in terms of the extent to which they are choosing to have students back on campus and engaging in in-person instruction. So again, we've seen all types of models from our higher ed institutions. I would say a trend that I'm seeing fairly often is kind of a program specific approach. Some college programs, just by nature of the program, they have these components that really require students to be in person, whether it's some of the healthcare programs that have a clinical component or science-based programs that have a lab component. So what some colleges are doing is focusing on having the students that are in those programs be on campus or be in person for those labs or those clinical experiences. But then for programs or for courses where it's a lecture or some type of class discussion that can be delivered in an online or virtual setting, then they're having those classes operate more virtually. There is not the same explicit requirement for higher ed institutions that higher ed institutions honor a request by a student to do all of their academic programming online if it's being offered in person. But certainly at a minimum, institutions need to consider requests reasonable and appropriate accommodations for students who have medical needs, who are medically unable to return to campus, or who are at a higher risk for COVID-19 according to CDC guidelines. For the getting into the use of waivers issue, I know Dennis touched on this a little bit. One area where we've seen waivers, the question about waivers come up is a lot of our college clients have asked us about the use of waivers or release forms for students who will be participating in clinical experiences, particularly at healthcare facilities where possibly the risk is greater because they may be coming into contact with people who have tested positive for COVID or who are suspected to have COVID. So Dennis touched on this kind of public policy concern. And so our position in the higher ed setting is that if a college is holding itself out as offering a certain clinical academic program, then the college has created an obligation to provide that program in a safe manner for its students. And so likely, if you had students sign a waiver as a condition upon participating in a clinical program, we believe that would potentially not be enforceable in court as against public policy. But what we've seen some colleges do as an alternative to having students sign a waiver is to create sort of an acknowledgement of risk document or an assumption of risk document where the student basically signs to acknowledge that they understand that there are inherent risks associated with participating in a clinical experience, particularly in a healthcare setting, and also kind of outlining the fact that these clinical experiences take place at a third-party off-site location. They're run by an off-site third-party agency, and so the college doesn't necessarily have control over the health and safety measures that third-party agency is putting in place. So I think those acknowledgement of risk forms, we've seen those used more commonly as an alternative to a waiver or a release of liability form. For health and safety measures and health and safety considerations, so I mentioned that, the school year has already started. So at this point, school districts and higher ed institutions, they're operating under one of those models that we talked about. But I think as the year progresses, school districts and colleges are still going to have to be consistently thinking about putting measures in place and enforcing measures to limit the risk of an outbreak or of spread of COVID-19 within their facilities. So Things that we've seen schools and colleges do are think about smaller class sizes where possible, spacing considerations within a particular classroom, particularly in those labs and those spaces where there's furniture that's fixed that can't be moved. Adjustments to academic schedules. We've seen a lot of schools having students, rather than having everybody show up at the beginning of the school day at the same time, they've been having students arrive at school on kind of a rolling basis. Limitations on building and classroom access. I think this can be tricky for colleges where there isn't one designated entrance to the campus. There's numerous buildings. There are people kind of coming and going throughout the day, but colleges are having to be creative in terms of limiting access by the public and just kind of limiting and directing people once they're in those buildings to make sure there isn't going to be a lot of people passing in the hallways, close interactions like that. And then similarly, limitations on student transitions between classrooms. What we're seeing a lot with the K through 12 districts is students kind of being in a cohort where they're with the same core group of students all day, rather than, traditionally for middle school and high school, a lot of times we see students transitioning throughout the building. They're having classes with different students throughout the day. During this time, a lot of schools are moving to a practice of just having students be with the same cohort or the same group of students throughout the day so that there isn't as much of that blending and mixing. And then face coverings. So for schools and colleges that are open for some form of in-person instruction, they must require all students to wear face coverings, with the exception of students who have, due to a medical or disability related reason, are prevented from wearing a face covering. So we do have to make exemptions for those students who have those documented medical or disability related needs. And the key here is documented. So IDPH guidance is clear. This is the guidance for K through 12 schools, but I think we can apply it to higher ed institutions as well. We can and should be requiring medical documentation as to that condition that prevents the student from being able to tolerate a face covering. For K through 12 students, depending on what their disability is or what their medical condition is, we may already have that required documentation or sufficient documentation in the student's IEP or in their 504 plan. But where we don't have any documentation of the medical condition that prevents the student from wearing the face covering, then we should request that. And many school districts are creating a form that the parent can take to their healthcare provider to fill out, kind of explaining what the condition is and what alternatives there might be. IDPH guidance says that for students who are medically unable to tolerate a face covering, that they may wear a face shield instead, but that social distancing needs to be strictly enforced with respect to those students. And then for all students, there's the IDPH FAQ for schools lists some limited scenarios where face coverings actually can be removed. Obviously, while a student's eating or drinking, they can temporarily remove their face covering. When they are outdoors, and physical distancing of at least 6 feet can be maintained, it's permitted for students to remove their face covering. And there are a few other examples as well. When students are playing musical instruments and they're outdoors and can be 6 feet apart, they can remove their face covering. And then there was a recently added exception as well for younger children who take naps at school. They can remove their face covering while napping, but they need to be closely monitored to make sure they stay in their designated napping area. And if the student gets up to use the restroom during the nap, they need to put the face covering back on. Okay, then the last area I want to talk about before I turn it over to Matt is procedures for scenarios where the district has a positive or suspected COVID-19 case. So guidance from ISB and from the Department of Public Health is very clear that if a student either arrives at school or during the school day is exhibiting one or more COVID-19 symptoms, and those symptoms are listed out in the guidance, that student needs to be immediately isolated from the school community. So schools are designating areas where the student can be isolated until their parent can come pick them up, a parent or guardian, and take them home, but they need to be isolated and sent home as soon as possible. The Department of Public Health recommends evaluation and testing for any person who's experiencing COVID-19 symptoms. And then the student needs to remain at home until he or she fulfills the applicable requirements for returning. And there's a IDPH put out a decision tree that kind of outlines the different scenarios, like what are the requirements if a student actually tests positive for COVID-19? What are the requirements if a student doesn't take a COVID-19 test but is diagnosed with some alternative diagnosis like the flu, for example? There are requirements for students who are exhibiting symptoms but who haven't tested positive for COVID-19. So definitely if you're a school administrator and you have a student who you've sent home due to symptoms, you'll want to immediately communicate with the Department of Public Health, communicate with the student and the family, and consult that decision tree about that'll tell you what would be required for that student to come back to school. And then this last bullet point is important too. If a student is sent home with suspected COVID-19 symptoms, IDPH guidance says all of the student's siblings or household members should also be sent home for quarantine until all requirements for returning are fulfilled. And again, those requirements will vary based on the outcome of the person who's actually exhibiting symptoms, like whether they take a test, whether their test is positive or negative. But so if we have a student who comes, we have a family of 3 siblings, they show up at school, one of them is exhibiting COVID-19 symptoms, all 3 of the siblings need to be sent home so that we can gather more information. And then you'll look at that decision tree to determine what the requirements would be for both the student experiencing symptoms to come back to school as well as their siblings. And then the last important piece is notification procedures. We get lots of calls about from both school districts and higher education institutions where they have a either suspected or a confirmed COVID-19 case, and they want to know what are their obligations, what should they do in terms of notifying people who might have come into close contact with that individual, but also notifying the school or the campus community as a whole. So the first thing that is absolutely needs to be the first thing you do if you have a positive or suspected case is contact your local health department. And they're really going to lead you and guide you in terms of any other notifications that you may need to make. But in most cases, you will end up sending a notification to students or to parents or guardians if there's a positive COVID case in those students' classroom. Then you would probably likely send a notice to the parents of all the other students in that classroom, letting them know that there was a positive case, obviously not identifying the student who tested positive by name, but just generally letting them know there was a positive case. And then you're going to also probably send a separate and more detailed notification to the student or to the parents or guardians of a student who came into close contact with the COVID-19 positive individual. And that I put close contact in quotes because that term is actually defined in the IDPH guidance. For those who actually came into close contact per that definition with the individual who tested positive, there will be quarantine required for them. So there's a separate notice that you likely would be sending to those individuals who came into close contact and who need to quarantine. And for those who are listening who are school administrators, our firm has put together a back to school toolkit for both K through 12 school districts and higher ed institutions that contain some of these sample notices. So definitely feel free to reach out to us if any of that would be useful to you. And then, just keep in mind when we're issuing notifications pertaining to student cases or student suspected cases that we have to be very careful and sensitive about student confidentiality and not releasing personally identifiable information about a student unless that disclosure is permissible under FERPA and ISRA. So FERPA is the federal law governing confidentiality of student records, and it applies to both K through 12 districts and higher ed institutions. And then ISRA, the Illinois School Student Records Act, is a state law governing student privacy and confidentiality, and it only applies to K through 12 districts. So there are some exceptions in FERPA and ISRA that would actually allow a school district to disclose the name or the personally identifiable information of a student who tests positive for COVID. One exception is the FERPA and ISRA school official exception, and that allows a school district to disclose student personally identifiable information to other officials within the school. So internally, other school officials who have a legitimate educational interest in the information. So that's what enables the school nurse to have a conversation with the school principal, for example, about a student who was experiencing COVID-19 symptoms. But then when we talk about external disclosures of student information, there's another exception under FERPA and ISRA that we refer to as the health or safety emergency exception. And that allows a school district or a higher ed institution to disclose personally identifiable student information where a health or safety emergency exists, and where the information is disclosed for purposes of addressing that health or safety emergency. There has been guidance put out during the COVID-19 pandemic making clear that the health or safety emergency applies to a school district or an educational institution disclosing student information to local public health officials when that information pertains to a positive or suspected COVID case, and when the information is disclosed for purposes of enabling the public health department to fulfill their obligations to address the pandemic and the public health emergency. But just note for K through 12 school districts, when a school district invokes this health or safety emergency exception, the Illinois School Student Records Act requires the district to notify the parent within 24 hours or within one school day of the disclosure to public health officials that the child's information has been disclosed. So if you're a school district and you have a positive COVID case and you contact the Department of Public Health and you share that student's name with the Public Health Department, that's likely going to be permissible under FERPA and ISRA, but you need to make sure that you notify that student's parent within one school day of that disclosure to public health officials that their child's information was disclosed. And so that information is included in some of our model notices in our toolkit as well. All right, with that, I'm going to turn it over to Matt to carry us home here. So thanks everybody for your time.
Emily, I have one quick point to make. The face covering guidance that you covered applies equally to school employees as well as students. So I was waiting for you to cover that. There is one exception that ISBE has carved out through some informal opinions. Typically, all employees and students, when you're in the building, must wear a face covering unless you've been accommodated otherwise. ISBE has said, though, that if there are no students in the building and an employee can isolate within an office with the door closed, they do not have to wear a face covering. This has come up recently with schools that are doing remote learning but requiring their teachers to come to work and teach from their classroom so they can close their door, not have to wear a face covering. And that's even true if they bring their child to school and the child is in the classroom with them doing their own remote learning. As long as the door is closed, the teacher does not have to wear a face covering. It's a different issue, though, if some schools are providing daycare for employees' children. And ISB has kind of opined that everyone needs to be wearing a face covering around those children, even if the doors are closed. But again, if the teacher is kind of self-isolating in a classroom teaching with the door closed, they would not have to wear a face covering. So it gets a little complicated, but it gets worked out.
All right, thank you, Emily and Dennis. As Dennis mentioned, my name is Matt Gardner. I'm in our basically operations group. We handle commercial transactions, construction, real estate, public finance for public bodies, and also many of those same issues for contractors in the private industry, real estate and other corporate clients. We're running out of time here today. There's a lot of issues, obviously, a lot of information. My topics here are on facilities management, operations, and general risk considerations. There's more slides than we have time for today, but certainly, as you look through the slides, if you have any questions, feel free to call me or email me. I'm certainly happy to talk through some of these issues. Obviously, there's just a lot of information on everything involving COVID-19. You can also find a lot of this information on our website. We have had a number of publications there. So I'm going to quickly, touch on a couple points and maybe leave a couple minutes for questions. The first couple slides really just talk about how you're allowing third parties to use your facilities and the risk analysis. Obviously, if you're having more people on campus or in your schools or in your private business, you have a greater potential for exposure or transmission of COVID-related claims. So some considerations to make, just the lack of control over those third parties, different interpretations of IDPH and CDC guidelines. And I think the thing that a number of private business owners, public bodies are worried about is potential liability. And we'll quickly touch on that a little later. Emily, next slide, please. Here we just list some of the considerations to think about when you're deciding whether to allow use of the facilities to third parties. You can certainly look at those. Generally, you obviously the cost benefit analysis. Emily, you can go to the next slide. These are some of the common third party users we see with public clients in particular. Whether, I think one area that public owners forget about when they're talking about use of their facilities and third parties on campus are general vendors, contractors who may have a construction project, lawyers, things like that, who could be on campus and potentially pose some risk. Next slide, please. There's a lot of guidance through IDPH, through the Illinois State Board of Education, through the Illinois Board of Higher Education concerning what measures to take to protect both your employees, students, and third parties who are on campus. This lists a number of those. Really, one thing to think about is we talked a little, I don't know if we talked in detail about screenings, but ISB certainly requires them. We certainly recommend them even for third-party vendors who are on campus. So have some sort of process where the vendors are screening and confirming they do not have symptoms or have had close contact. Emily, you can go to the next slide. This is a big thing I would like to touch on and spend more time on, certainly, but look at your contracts. Make sure you have provisions that are going to protect your entity, whether it be a college, school, or private business. You want to be shifting the risk to your vendors if possible, and make sure there's adequate insurance and indemnification. Emily, next slide. We talked a little about waivers and the concerns with public policy. Here's certainly a little more. I would note that for employees, those waivers may be barred by, and we have really looked at this in the private industry, by the Workers' Compensation Act. So, they may not be foolproof, certainly, but we do think having some sort of assumption of risk or acknowledgement of the risk and agreement to follow applicable guidelines is appropriate. Next slide, please, Emily. One thing that has been a major legal issue over the last few months is insurance coverage, and whether your commercial general liability policy will cover a COVID-related claim. I think the first thing to look at, I mean, that's an unknown answer right now. Coverage law is extremely complex, and there's multiple class action and just general cases that are filed. But look to see if you have a communicable disease exclusion in your policy, or if you're having a contractor provided policy, make sure that that exclusion, or try to have that exclusion not be included in the policy. You may need to talk to your insurance professional a little more about that. Next slide, Emily. And then really questions about liability, that's a big concern. We do think in general these claims, like if there is a transmittable disease and a claim where a employee or a general invitee or a student says, I contracted COVID-19 because of the college's negligence in operating and allowing students on campus, or in a private business, et cetera. Those are going to be hard. We think those are going to be hard claims to prove for a number of reasons. I mean, it's difficult to identify where you obviously contracted the disease, but do note for public bodies, there's an additional line of defenses under the Tort Immunity Act. So this would apply to school districts, community colleges, state universities, et cetera. But it basically states that claims arising from a public body's acts of discretion in their policy decisions. So that could be, allowing students on campus or allowing certain programs. It's a fairly complex analysis, but talk to your legal professionals about how to protect, how to implement policies that will trigger the tort immunity defenses. So not only is there a general tort immunity defense under Section 2201, which we list here, but if you turn to the next slide, Emily, the Tort Immunity Act has a specific provision for communicable diseases. And not only, it's very similar. It's a acts of discretion. That's something to be aware of. I mean, there are certain requirements that especially ISB implements in terms of limiting rooms to 50 persons, although it's 25 for the Metro East right now because of Executive Order 54. Other requirements regarding face coverings, screening, et cetera. You need to follow those requirements to trigger these discretionary immunity defenses. It's only where you have discretion in terms of implementing certain policies that these will apply. So again, I'm happy to discuss more on these in more detail if you have any questions. If there are any general questions, we'd invite you to ask those at this time.
Wonderful. Does anybody have any questions? I know this was a very power-packed presentation with a lot of really great information. Oh my gosh. It makes me think a lot about what our schools are going through. So anybody have any questions, or we can certainly contact the group afterwards. We'll definitely have the video of this up, and I'm sure people will like to go through that. We'll definitely send that to our education committee as well. Anybody with questions at this moment in time? No?
And I would suggest if you do have questions, all three of our email addresses are available through our website, but if you want to email Liz or Amanda, they can forward those questions to us as well.
Well, we want to thank you, Dennis and Emily and Matt, for your time today. Very informative presentation, needless to say, and extremely important to all of us parents and educators and everybody throughout the region. So we thank you very much for your time today and wish everybody a good rest of your week. Thank you all. Take care.
Thanks.
Thank you very
Bye-bye.
much.